a difficult time setting your VCR, you can imagine that having 350 different sets of forms can be quite daunting. And most people just simply say, forget it. I can't do this. Problem with that is that we know we have a problem with our health care in this country, especially with billing and the amount of deficit that we have for the money. We know Medicare is hurting. We know Medicaid in most states are barely surviving. Some are not surviving. So then we have folks out in our community that have to make the decision between, am I going to buy groceries this week or am I going to buy my medicines that I need to keep myself healthy? Well, we all know we have to eat, and most people side on eating versus taking their prescription medicines. Well, that creates a big problem because if we're not taking our medications, as the good doctor spoke earlier, if your blood pressure is not controlled, we can have a plethora of problems come out of that. And what we see is we see folks not taking their medications and they end up right back in the old hospital. And then that just costs the healthcare system even more money. We already know it's struggling, so now we're going to add more money that it's going to take to treat our folks because they cannot afford the medications that could keep them out of the hospital. Doesn't make a lot of sense, does it? Seems like we need to do something about that. Well, basically how Heart got founded was there was a man, a local Paducah man actually, his name is Chuck Thompson. Some man who was in his 50s, he was disabled. A bright man, one who always wanted to find out more things. As he put it, we live in a no-question zone because we have the internet, and I can find out anything I need to. So he started working around and messing with this and that and looking here and there. And what he found out was that I know how to get medicines free. He figured it out. I was actually following Chuck. He was a patient of mine when I worked for Lewis Home Health Care, and I used to go visit him usually twice a week. And I remember coming into his house one day, and he was excited as he could be. He said, "Joe, I got to tell you something." I said, "What is it, Chuck? What? He said, "I have learned how to do something, and I just can't sit on it. I can't sit on it. I've got to share it with everybody and anybody that I can. I need to hang up a shingle. Will you help me?" I said, "Absolutely, I'll help you. What is it?" I probably should ask him what it was before I agreed, but it turned out it was a good thing to do. He said, "I have learned how to get my medicines for free. I know how to do it. I understand it. I can do this." I said, "Well, absolutely, I'll help you. What do you want me to do?" He said, "Get the word out." I said, "I'll do that. I'll go out there and I'll tell anybody and everybody I can tell how to do that." So Heart was basically funded at that point off of a Social Security income check, Chuck's. He had another friend named Brian Hilleman who was a delivery man for Pizza Hut. And he took his Pizza Hut delivery tips and he helped fund Heart USA. So we had Social Security income, we had pizza delivery tips. I can tell you that the combined amount for an operation, that's not a lot of money. Paper and file cabinets cost money, folders cost money, computers cost money, phone lines cost money, the electricity costs money. All these things take money. Well, we didn't have a lot of money, so we just had to basically do what we could do. So Chuck had an old home computer that he basically gave up for his own use and donated it to himself for use in Heart USA. We staggered along for about 2 years, helping mostly friends and family and friends of those folks, and it just kind of filtered through the community. And then WPSD kind of got wind of what we were doing. And do you guys remember they used to do the 6 Who Cares? Remember that? Well, Chuck won the 6 Who Cares. They found out about it and actually came and interviewed him. And I think we got $50 for that, which went right into Heart USA, bought us some paper. And boy, did we see an influx of applications after that broadcast. How do you beat it? Everybody watches the news, or most people do, so we did that. Well, all of a sudden, we found ourselves overwhelmed. We had more business and people that needed help than what we could really manage. So we had kind of a little bit of a bottleneck effect take place. This went on for about 2 months, and people started forgetting about the medication program. So we saw a slack off of the amount of new patients we got. About another year went by, and the state of Kentucky caught wind of what we were doing, Frankfort. And they sent some pretty high officials down to the Heart home, which was out of Chuck's home. And we sat around a table and they said, "Gosh, man, you guys have really helped a lot of people without any funding. How have you done it?" We said, "Well, we prayed a lot. We've gotten donations from those we've helped. They might come by and bring us a ream of paper. But it is a challenge for us. The state said, you know what, you're doing such a good job, we're going to fund you. We're going to fund you. So we did the necessary paperwork and became a nonprofit organization recognized by the state. And they began funding us $30,000 a year. We said, praise the Lord, we can help more people with this. Also, the good people of Minolta decided that they would go ahead and donate us a brand new copier. God bless them for that. We needed it. So we got the money, and we decided it's time to upgrade so we can start helping more people. So we got us a couple of computer systems, got us an additional phone line, different office supplies that we need. We started getting more volunteers, and keep in mind the volunteers that we had were folks we had helped through Heart USA. They were so appreciative of what we had done for them that they actually came and volunteered their time. We taught them what they needed to know, and then they began helping other people as well. This went on for about 2 years. The state of Kentucky came back and said, gosh, guys, you guys have taken $30,000 and you're turning it into $1 million. That's what you're doing. And we said, yeah, we know. There's a lot of need out there. They said, we want to buy your program from you. We want your program. We're going to pay you for it. Chuck looked at him and said, no. If you want the program, state, you can have it. We've never made a dime on this program. I've never made a dime. Chuck's never made a dime. Bryant never made a dime. None of the volunteers ever made a dime on the program. We said, if you want this program, we'll just give you the program. We started it to help people, not to make a profit. That was never our goal. Our goal was to help those in our community. Well, it turns out the state doesn't really like doing that. They would rather pay for what they get. But we would not budge, and eventually they agreed to take the program. So we gave it to them. Last year, in January, Steve Beshear signed our program into law. Heart USA is now a law. It's not called Heart USA, it's actually called KPAP, the Kentucky Prescription Assistance Program, but it was based off of our program. They asked us to help them set this up and get it going. Of course, the state does things a little differently than what we did, but we did assist them. We went to Frankfort many times, sit and spoke with them. And today, that program is up and running. So anywhere now in the state of Kentucky, you can get assistance with your prescriptions through the KPAP program. Last year, Chuck was also awarded the Governor's Award for the state of Kentucky for his work in helping those in the community. So that's a little brief history of Heart. We kind of started off with an idea, some friends and family, a Social Security check, ended up with state funding, ended up as being written into law. We never thought that would happen. We just wanted to help people, but God is good. He is good. So a lot of people say, well, how do I get the prescription? I mean, I get a lot of questions. I get things, well, does it matter if I live in Murray? Does it matter if I live in Illinois? Does it matter if I have a brother-in-law down in Texas? He needs help. Can you help them? The answer to those questions are yes. On the outline, you'll see what are the geographical limits. I can tell you there are no geographic limits. If you live in the United States of America, you can get assistance. It does not matter that it was started in Paducah. It does not matter that we helped people in the Paducah area. We have actually helped people as far away as Arizona get their medications free. Someone had a relative and said, here's a great program, friend in Arizona, call here. And we were able to assist them. The next question I often get is, well, is this just for the elderly? Or is this for a younger person? Is this for, who is this for? The answer to that question is very simple. It is for anybody. It does not matter what your age is. It makes no difference what your age is. I remember being in Vienna, Illinois. I was working with a friend of mine. He has a sawmill. We were sawing some wood up, and actually we were pouring concrete that day. And a man drove up in the concrete truck, and he said he had a son with cystic fibrosis, a young child, about 4 years old, and the medication cost for him was just exorbitant to pay for the medications. Obviously, the child needed them. This is obviously one of those ones you can't say, nah, I just won't take that. You might do that for yourself, but you're not going to do that for your child. You're going to do whatever you can to get those medications. And so I started talking to him about the Heart program and the prescription assistance program. And he was concerned, well, but he's a child. I don't think they'll do it. I said, yeah, they'll do it. A couple of months later, the man was getting his medicines for his child in the mail free. he was getting them. So it will help anybody of any age. Does not matter what your age is. The next question I often get is, what are the income requirements? Bound to be some sort of income requirement, and there is. But I can tell you that the income requirement varies between each individual drug company. After all, it is their programs. So Bristol may have this limit. The other one over here, Novartis, may have this one. Merck may have this one. But I can tell you on average, it's actually fairly liberal. It's well above the poverty line, which is a good thing. So you can basically say that if you make $21,000 a year or less, you qualify for the drug programs. I don't believe there's any of them that are any less than that. I believe they're all that amount or maybe even a little bit more per year. That's just for a single household. If you live by yourself in a single household, you need to make $21,000 or less in a year to qualify for the program. If you have dependents in the home, you get to add an additional $7,000 to your yearly income, and you'll still qualify. So if there's two in your home, $28,000 a year or less, and you can qualify for the program. You've got 2 kids and a wife. I don't know if I can do the math that high, but just add $7,000 per each dependent you have, and you qualify. Qualify. Another question I would get from folks, especially from our elderly folks, I get this one from them a lot, is what about taxes? What about taxes? I know there are some folks that live on Social Security income that may make less than what is required to file an income tax return. I'm sure there are. I've met several that are. That's okay. You may think to yourself, well, don't we have to prove what we make a year? Yeah, you do. But there's ways around that, and we can help you with that. We can make sure that you get the help that you need, even if you don't file tax income returns. You just need to let us know that whenever we talk. You can still qualify. So once some of these questions are answered, and the next one I get, well, how do I contact the Heart Home? How do I get a hold of these guys? Well, if you have your pens handy, I'll tell you how to contact the Heart Home. It's here locally in Paducah, and the phone number is this. It is 270-442-2590. Now keep in mind, this is all run out of Chuck's home. He does live there, although very cramped with the amount of office supplies and copiers and computers and TV screens and all these equipment that they have there in the center in his home. So he does limit the hours of the day and the days of the week that he accepts calls. And I will tell you those. Chuck receives calls on that phone number for Heart on Mondays, Tuesdays, Thursdays, and Fridays. During those days, his phones are open for phone calls between 2 p.m. and 5 p.m. About 3 hours. Of course, there's a reason for that. We don't have a full complement of staff. We don't have 25 people in the Heart Home. We have about 2. So we try to limit the number so that we can successfully help every person. We don't want to get someone to call us and say, well, it's going to be a month and a half before I can help you. That doesn't help you. So we try to structure everything to where we can help the amount of flow we have in an expedient way to make sure we can help everyone we can. So if you call between those hours, there is a chance that you'll call and it will be busy. Just keep calling. You'll get through eventually. You will get through, and then they will be able to assist you at that point. Now, before you call, you're going to need to do a little bit of preparation. You're going to need to know a few things. One, you're going to need to know what was your yearly income, your gross income. Not your net, but your gross income. What was it? For those of us that do file our tax returns, you can find it very easily on it. And that's what we typically will ask for. What was your gross income on your tax return? That's the easiest way to get it. They're also going to need to know what medicines that you take. And now that doesn't just mean that, yeah, I'm on a blood pressure medicine. No, I need to know the name of the blood pressure medicine. I need to know the dose. of the blood pressure medicine that you're on. If you're on, a good example would be like the low pressor, a pretty common drug. Are you on 50 milligrams or 100 milligrams? Are you on 25 milligrams? How much are you on? How often you take it a day? Do we take it once a day? Are we taking this twice a day, 3 times a day, 4 times a day? Whatever the case may be, we need to know that. We also need to know who is the prescribing physician for this medication. Very important. Must know that. Must know who the doctor is. Need to know that. Also, we need to know, is the doctor, do you have a doctor? And I know it may sound funny, but if you go to the emergency room and they say your blood pressure's up and writing you a prescription for low pressure and they send you out the door, your ER doctor is not going to be your primary doctor. Even though they're the prescribing doctor, they're not going to be the ones writing your refills. I guess unless you go back to the ER because you're in a hypertensive crisis again, maybe they will. But for the most part, ER doctors don't follow you as a primary physician. So we need to know who the doctor is that's going to be writing the prescriptions for your medications. Must know that. Doesn't have to be the same one. It can be 2 different ones, 3 different ones, 4. I know sometimes different doctors prescribe different things, but we need to know that. So my advice to you would be to have that information readily available. Be prepared when you call. It will really expedite matters when you speak with a volunteer at the Heart Home. What they'll do, I have to follow my outline. What they'll do is they'll actually ask you all this information and they'll make notes of it as they go. And really, they're going to ask you a lot of personal questions. They're going to ask you, how many folks are in your house? How much money did you make last year? Do you have any insurance coverage? If so, what type of insurance coverage do you have? Ask you your medications, dosages, frequency, prescribing physician. They're going to ask you all of those things. What they're doing is they're trying to see if you qualify. They're kind of pre-screening you. They're kind of getting an idea, is it reasonable that we can help this person, or is there no way that we can help this person in this situation? And they'll tell you that at the end of the interview. They'll say, yes, we can help you, or no, we cannot help you. So another big question I get from folks is, well, what drugs can you get? Well, it's a good question, very valid question. The simple answer to that is, I don't know. We write the drugs down and we go to each individual drug company programs and we research it and we try to find it and we look for it. Now, the folks that are over there volunteering doing this every day, they have a pretty good idea. If they run across some that's pretty standard, they're going to say, oh yeah, there's one there. And they're going to know some of the ones right off the bat that, oh no, there's no program for that one. But honestly, I don't know. You have to call and find out. They will research that for you, and then they will let you know. Now, not everything in the program is going to be free. Sometimes we find a medication that has a program, but the program is a discount program that the drug company offers. They may say, well, yeah, we know folks are needing help. I know it's a $300 a month drug, so we'll do it for $60 a month. So they can help you that way. Ideally, we'll find a program that's free and get you the ones that are free. Also, they may run across and say, oh, well, yeah, this one here's, they're going to do it for $10 a month. But this actually is a drug that's on the Walmart or Kroger $4 a month list. They'll tell you that. Nah, we're not going to do this for you on this drug because you can get it cheaper at Walmart. So go do that. We'll tell you that as well. And we'll know that fairly quickly. So now let's just assume that you've given all the information to the volunteers, and the volunteer says, okay, yeah, I believe we can help you. Next thing they're going to do is they're going to make you an appointment to come into the Heart Home and sit down with one of the volunteers. They'll give you the date, the time, and they'll also tell you what you need to bring. You'll need to bring copies of that tax return unless you don't have one, at which time you need to tell them when you talk to them on the phone, well, I don't have that. They'll tell you what you need to do to bypass that problem. You'll need to bring a list of all of your medications. All the information you gave them, you're going to need to bring that in with you and have it with you. When you get there, you'll come into he's got a little addition, he's got a little wheelchair ramp, we've got lighted areas. It's all up for disabled folks and folks that are not disabled. It's set up for everybody. Everybody can access the Heart Home. You'll come in, you'll meet the volunteer, you might even meet Chuck. He doesn't do it quite as much as he used to. His health is not the greatest, but You will meet one representative of the heart. And just for disclosure here, we are HIPAA compliant, so we do not share any health-related information to anyone about you. Only the volunteers of heart have any access to that. You'll come in, you'll sit down, and they will actually go line by line with you down through the medications, and is there a program, is there not a program, and they will actually prepare those forms for the assistance for you right there while you're there. If you have 2 drugs, it won't take very long. If you've got 10, it's going to take a little longer. It may take up to an hour. They will typically schedule your appointment to reflect the number of medicines that you have so that you have plenty of time to get done what needs to get done. So they will actually go through each program. They will get the appropriate form for the appropriate drug. They will actually input the information on the form for you. They will get everything ready to roll. They will put the prescribing doctor's name on it. All that stuff will be there. When you walk out of the heart home, you will have in your possession everything you need at that point to get your medications. The other neat thing about prescription assistance is that it's all color-coded, how we do it. We put it on there by the individual drug company name, a certain color code. And you'll see that for each individual drug company and what their requirements are for your medications, how much you'll receive for each delivery that you get. Most of them send 3 months at a time, so you'll get 3 months of the medication at a time. But you'll receive everything that you need. The other thing that you'll need to do when you go to the heart home is bring an envelope with a stamp on it. You might need to bring 2. They'll basically let you know that. And that's because it has to be mailed to the drug company. So you will receive all the prescription forms and things that you need. They'll be fully filled out. They will be ready to roll. Ready to roll. Now comes the next stage in it. You need to go see your doctor, because we can fill the forms out all day, but we cannot write prescriptions. Unfortunately, none of us at the Heart USA Home are physicians that have the ability to sign a prescription pad. Therefore, you will have to go see your doctor. But you need to take your forms to the doctor as well, and they will explain that to you at the Heart Home. You'll also need to take those individual stamped envelopes, which will be filled out of where they need to go, and you basically need to take that information to your doctor and say, "Doc, I need you to sign my forms here, and I need you to place the prescriptions on my forms. Staple them, whatever." Doc will get those, we'll sign those, we'll write the prescriptions. It'll all be on the forms what the doctor needs to write. We try not to be doctors, but we know what the drug company wants written, so we usually do it for the physician with instructions, and they go, "Oh, okay," and they write the prescription appropriately. Stamp it on there. The doctor's office will fold that up, put it in the envelope that you have provided, and then they will drop it in the mail for you. Doesn't cost the doctor a thing. They don't have to pay for the postage because you've already done that. You've already taken care of that for them. About 30 days later, you'll start seeing your medicines come in the mail. Maybe a little sooner, maybe a little later, depends on the drug company. But on average, it's about 30 days. You'll start seeing medicines coming. Your doctor plays an important role. You have to have the doctor sign the forms. They must also sign the prescriptions. So a question that I get now and again is, well, how do I know if my doctor participates? I would probably call ahead to your doctor and ask them if they do. Are you willing to do this? I can tell you that in the Paducah area, there's only 2 physicians that we have run across that refuse to sign the forms and the prescriptions for their patients. Only 2. So there's a really good chance that your doctor will do that. The other question is, well, what if they won't do it? What should I do? Well, like the good doctor said earlier, fire them. You have the right to fire your physician, and I would fire them, because if they're not concerned about you taking your medicines to sign one paper, I don't know that I'd have much use for that person. I would probably move off to another one. Get you another doctor, one that does participate. Take those forms to that doctor. Now, they may not sign it the first day because they're going to want to examine you. They're not going to sign blind stuff, not knowing about you. But get an appointment with them, let them check you out. They'll sign your forms and send it in. You'll get your medicines. Like I said, it's about 30 days. Now, the medicines can kind of go different places. They don't all always come to your home. A good example would be insulin. Some of the insulin programs will actually be delivered to your doctor. They'll be sent to the doctor in your name. Just need to go out to the doctor's office when it gets there and pick it up. But most of the other medications will come to your home, right to your mailbox. Usually get 3 months supply at a time. Keep in mind, there are some medications that I tell you that we cannot get for you, and that would include any type of narcotics. Loratab, Tylenol 3s, Percocet, Percodan, any of the narcotics. There is no prescription drug program for those medications, so those we can't help you with. Typically, those medications, however, are inexpensive at the pharmacy in comparison to ones like Lamictal. I don't know if anybody knows what that is, but I know what it is because I buy it every month. It's extremely expensive stuff. Next question is, okay, well, that's great. I've got in the program. I've got my forms. We've mailed them off. I've received my 3 months prescription, but now I am about a month into this. I got 2 months left of my prescription here in my hand. What am I going to do about my next, my refill? Where do I go to get a refill? That's the beauty of the Heart USA program and the color coding system, because the color coding system breaks down each individual drug manufacturer and tells you precisely what you need to do to get your refill. We also put instructions on there about timeliness. We do not want to wait till we have a weeks of medication left to try to get our refills, because we know it's going to take about 30 days for the medicines to come once we mail the letter to the drug company. So we don't want to have a time lapse of 2 or 3 weeks where you have no medicine. So when you get the information from the Heart Home, you need to make sure you keep that. You're going to have the set that goes to the doctor and the set that you're going to keep. And that set you're going to keep it safe. Keep it where you know you can find it, because it is going to tell you what you need to do. Some of the medications, you just simply need to pick up the phone and call the drug company. The phone number for them will be on your information. The exact number you need to call to request your refill. Some of them you will have to go back to the Heart Home for and have them re-up your application. There are some drug companies that require that. Some of them, your physician's office will have to call to get your refill. And some of them, you'll have to do a new application every single month, and you'll only get a month of prescription each time you do it. So it really just varies, depends on the drug company. But that's why we broke it down and color-coded it, so that you could keep track. If you have 3 medicines that Merck makes, they're all going to be in the same color. You're going to know to do the same thing for all 3 of your medications. So then the next question comes up is, okay, great, got it, I understand about my refills now. I know I need to call the drug company or call my doctor or call the Heart Home. But even if you don't get it, because sometimes even simple things can confuse us at times. I know they do me sometimes. If you have a question about that, all you got to do is pick up the phone on those days and call the Heart Home and say, I'm just kind of confused. What do I need to do? And Heart Home will be more than happy to help you with that. They keep your file in a cabinet. They can pull you right up. They can go in there and say, okay, here's what we need to do. And they'll assist you with that. Most of the drug companies, once you do the initial application and get approved for assistance, it is generally good for 1 year. For 1 whole year, all you got to do is follow the refill guidelines to get your medications for that whole year. As long as you do that, you'll be fine. I know there's one company that requires you to re-up about every month. So about every 2 weeks, you're having to basically resend in the information. And they may have changed that since I last looked into it, because they do change their programs yearly. The income amounts change. But right now, they're still around $21,000 for a single household. Here are some of the key points to it is, if you have prescription drug coverage, we may not be able to help you. Now, the key word there being may not be able to help you. A lot of folks have Medicare with the Medicare Part D, and everyone has heard of the donut hole, I'm sure. And of course, I'm not talking about what you get down at Red's, although they are delicious. But even if you have Part D coverage, or you have veterans benefits, or you have a prescription drug plan, we still might be able to help you. A good example of that is folks who take the drug Lanoxin. There may be some of you here that is on that. It's got several names: Digitec, Digoxin, Lanoxin, Digitalis, several names of it. But that particular drug, once you get into the donut hole period, you're having to pay out of pocket to get this medication. We actually had someone who was having to do that and was having difficulty with the other cost of their medications, affording it. We couldn't help the person with very many of their medications, but we were able to help with Anoxin, because once we got into that donut hole, we then sent the applications in. The drug company said, okay, yes, we see. And we got them the last 2 months of their year for free. So they had to pay for it, 10 months out of the year, but at least for 2 months, they were able to get that medication without any cost to them. So that was a big help to them. In the 7 years that we've done this, and this number is going to be a little bit outdated, but just to give you an idea of what we've been able to do, is we have saved this community alone over $8 million in drug costs. $8 million. That's a lot of money. $8 million that these folks wouldn't have spent on their medicines because they couldn't afford them. We have had folks come in, didn't know what to do, and walk out crying their eyes out, knowing that they were going to get the medicines that they need for a healthy lifestyle. Actually hit home for me. My mother, God bless her, she became disabled with a condition known as pulmonary hypertension. There is no treatment for that. Well, there is treatment, there's no cure. But the treatment for that, there's two things you can do. You can do a heart-lung transplant. You might be able to transplant a heart and do okay. You might be able to transplant a lung, do okay. Transplanting both is kind of double trouble, which we felt was a bad deal and decided that's probably not in the best interest of our mother, and she made that decision as well. But the problem is that the medicine that they use for that, or one of the medicines they use, is known as Revatio. And Revatio, very few people know about Revatio because it's not very widely used. But that medication was running around $3,000 a month. $3,000 a month. Her total pharmacy bill was $5,000 a month. And of course, keep in mind, whenever you're deemed disabled, you have to wait 2 years before you can be deemed eligible for Medicare benefits. Therefore, yes, we know you're disabled. Yes, we know you can't work. But if you survive for 2 years, we'll give you insurance. We think that's a good deal. So good luck to you. Hope you survive for 2 years. Well, of course, when this happened, she had no insurance. She had no prescription coverage. Now, being the loving son that I like to think I am, and my brother, we wanted to help her. But I'll just be quite honest, I couldn't afford $5,000 a month, and I work full time. Couldn't do it. She most certainly couldn't do it. She couldn't hold a job down. She couldn't breathe well enough to hold a job. Between me and my brother, we couldn't afford $5,000 a month. But I knew about this. I called Chuck. I said, buddy, I need a favor. I need her in there. We need to get her in there. My mother went to the Heart Home, and in about 45 minutes, she walked out of the Heart Home with a $15 a month pharmacy bill. Turns out Iron does not have a drug program. That's okay. I can afford $15 a month. I can do that. I can handle that. So she did not have to worry about eating or taking her medicine and ended up back in the hospital. She now was able to get the medications that she needed at no cost to her. And even to this day, she still continues to get her medicines free in the mail. Her insulin goes to the doctor's office. Insulin's getting expensive, by the way. It's getting expensive. So, are there any questions that anybody has about the program?
Who pays you?
Nobody pays us. As far as for you, like if you needed help, you wouldn't pay us either. It's completely free to anybody.
You work there, right?
That is my non-paying job.
Okay. That's my next question. How do you make a living?
I work for Medical Center of Paducah.
Okay.
That's my paying job. No, everybody at the Heart Home is strictly a volunteer. We make absolutely no profit whatsoever. It is free to any and all. It does not matter. You read the things we don't discriminate about, blah, blah, blah. We don't either. Whatever all that says, we don't either. We don't care who you are. We don't care how rich you are, poor you are. Now, the drug company might care how rich you are. We don't care what color you are. We don't care what religion you are. We don't care. We don't care. If you need the help, come get it. We want you to come get it. We want to help people as much as we can. That's exactly why when the state said, but we want to pay you guys for your program, Chuck said, listen, state, I get my pay out of seeing someone walking here not knowing what they're going to do, and then spending a little time with us and walking out of here knowing that they're going to get the life-saving medicines that they need. That's my pay. And that's all the pay that we're after. Yes, ma'am.
What about persons, let's say they leave a facility, they have Medicare Part D, but they still can't pay all the copay? Does it help towards copays, or is that kind of like a no, we feel like you can pay it on your own?
Good question. The question was about Part D copays. Can you afford the copays? Can we help? Unfortunately, it's a yeah, it's a maybe and a no. We certainly cannot help with anything monetary. We cannot monetarily pay a copay or anything like that.
What I'm saying is, will the drug companies look at it, or will they automatically say, you have a plan, you should be able to afford it?
They will look at it. Yes, they will look at it. Some of the companies will. Now, some of them will just say absolutely, hands down, absolutely not. If you have insurance, we're just not even going to even look at it. But there are some of the companies that say, okay, well, let us look at it. So my advice to everybody is, regardless of whether you have insurance or not, call the Heart Home. Let them investigate it, because they might be able to help you. They may not be able to help you get every one of your medicines, but if they can help you get 2 or 3 of your medicines, that's 2 or 3 less you have to pay for. Yes, ma'am.
Do people from out of state have to call this number, or do you have other numbers for different states?
For what I'm with, they can just call this number. There is actually a state number. It is actually set up for the citizens of Kentucky. Now, whether or not they are willing to accept those out of state, I really don't know, because that's the state's doing. So they took our program and made it statewide, and they run it. So it's kind of their rules. But for Heart USA, because we're considered technically separate from the KPAP program, we're a separate entity. But for us, we don't care where you live. You can live in Hawaii as far as we're concerned. Give us a call, and if you can't come into the Heart Home because you live in Hawaii and that's an awfully long swim, we can actually get the information, do phone interviews. And there was actually a thing that Chuck made up, and I'm not sure if he's using this now or not, but he actually created this thing called Chucky in a Box. And if you've ever met Chuck, you'd understand his sense of humor and why that came about. But it was actually the prescription assistance program, everything that you needed in a box that he could actually send you, because there are those who are homebound and are unable to get out. We actually had a little scooter that we were taking to people's house whenever they couldn't come into the Heart Home to assist them with completion of the process. So my advice is call. It doesn't matter if you're out of state, in state, wherever. Like I said, we've helped people as far as Arizona before.
What is the difference between your KPAP that you're talking about and Heart Home? You said they're the same program.
It's the same program. It is, because the program is run by the drug companies. We just know how to access them. We're more or less how you access the program. KPAP is actually run by the state, funded by the state. We are also funded by the state, but we are actually considered separate. KPAP is administered by the state. Heart USA is administered by Chuck Thompson and a volunteer group, by the steering and board committee. So it'd be kind of like your difference in, I don't know, the Medicaid versus somebody who just had your local soup kitchen. So.
Would they go about that kind of like going to DCBS?
I'm sorry?
Would they go to community-based services and places like that? Is that where you would send them for KPAP? And let's say
That I'll have to find out about. I'm not really sure, because when they put this online, I was not in the loop of that. But what I would probably do, in fact, I can probably do that, as Chuck said, we're in the no question zone, because all we have to do is get on the internet. I would imagine that we could just Google Kentucky Prescription Assistance Program and we could get every phone number we need. It is actually a government-run program. It is actually separate of us, although we're funded by the government. But they actually look at the numbers differently, because they say, well, we'll give you this much money, so what did you turn this into? Well, in our case, we took $30,000, turned it into $1 million. They said, well, we gave you $30,000, but you saved $1 million in prescription costs, therefore you just turned 30 to $1 million, if that makes sense. As long as we continue to do that, the state's going to be very happy, and as long as the budget maintains, Heart USA will remain. Any other questions? Yes, ma'am.
In some cases, for your Medicare and Medicaid will pay for some scripts, but it won't pay for all of them. So for those that they do not cover, do y'all help out on that?
Yes, call. And like I said, I don't know if I can get you that particular drug, but if there is a program for it, we can get it for you. A lot of the drug companies say, well, yeah, okay, we know that this is not covered by so-and-so, so yes, we'll go ahead and supply this medication to you. You can also get a denial from a drug company, and then you can turn around and do an appeal. And with the appeal, we've won a lot of the appeals on that and got people their medication. It kind of delays it. You're getting the medicines, you're not going to get them quite as quickly because you have to go through those processes. But yes, if you have one that's not covered by your insurance, call us. We may be able to get that drug for you. Mm-hmm. Good questions. Anybody else? No? Yes, ma'am.
Things is the duration of the prescription assistance?
Yes. When you make initial application to that and you are approved, for almost all of the drug companies, that is good for 1 year. Right. Now, the next year rolls around, and they're going to want to have your next year's tax returns. We're going to see all that again to make sure you qualify. We do have some folks, and sometimes they get lucky. We actually had a lady that the date of her application was just before tax day. And as it turned out, she was going to be about $10, $15 over the limit. But since her anniversary date was before tax day, we were able to use her last year's tax return. So she was able to qualify for 1 more year. Now, the year after that, we couldn't help her anymore. She no longer met the requirement, which is unfortunate because $15 extra a year is not going to cover the additional cost of the medications. But so it kind of depends on your anniversary. But it is a 1-year thing. There is one company that has you re-up about every month.
Okay, but as long as you're in the same tax thing,
Good to go. Right, and if you get a new, right, yeah, you're fine. As long as you're in, you're in. And then if you get a new medication, you just need to call the hard home and say, I've got this new medication, and they'll set you an appointment, come in, and they'll get that form sent in and start getting that sent to you if they can. You might have to, if your doctor has samples, I'd get samples. If not, you might have to buy 1 month while this process is going on. But then if you get the rest of the year free on that medication, it's still a great savings to you.
Okay, so you do something that's a continuing, say, medication. You don't do for like something that's a expensive cream that your doctor wants you to put on for whatever?
Right. I mean, I think in theory we could get it, but by the time we could get it, you would have already used it and no longer need it. So at that point, what's the use in it? Yeah. Absolutely. The question there was, you do more longer-term medications, maintenance medications, and basically that is true because if some doctor says, well, I want you to take this for 2 weeks, it's going to take me 30 to 40 days to get you that medicine. By that time, you don't need it anymore. So we wouldn't be able to help you with that. Some good questions. Any others? Any others? Okay, well, I would ask that each and every one of you take the information, use it, and tell a friend. I'll tell you, I went out and ate not too long ago, and pretty much any time I do, the waiter or waitress comes up and I look at them, I go, can you afford your medicines? And then I'll just ask them, and now it embarrasses my wife sometimes. God bless her, it does. But I ask them, and you would not believe I've probably got 4 or 5 or 6 out of 15 or 20 I've talked to actually, number one, take me seriously and not think I'm trying to jive them or something. But we've actually helped some of these folks just by simply saying, hey, can you afford this? And just let them know the number and the times. And so if you know folks out there that need this, friends, neighbors, family, church members, whoever it is, even if it's your enemy, tell them, because maybe if they get their medications, they'll be nicer to you, right? All right. Thank you guys so much.